Good evening and welcome to Chicago Tonight. I'm Brandis Friedman here in our Northwest Side studio.
And I'm Paris Schutz reporting live in Bronzeville as part of our In Your Neighborhood series.
On the show tonight, the city is expanding a Chicago Police Department program aimed at keeping people addicted to drugs out of jail and getting them into treatment.
If it was not for the community standing up, this hospital would be closed.
Bronzeville's Mercy Hospital has a new owner, and the site of the former Michael Reese Hospital is headed for redevelopment. That's on tonight's In Your Neighborhood. Researchers create technology that can translate a paralyzed man's brain waves into text. That and other science stories making headlines. From plastic podiums to medals made out of recycled smartphones, how the 2020 Olympic Games are putting sustainability front and center.
1, 2, 3.
How one local photographer is using her art to help women speak up. And Jeffrey Baer on the staying power of Chicago's German history in Ask Jeffrey.
And Brandis, as we mentioned, I'm live in Bronzeville tonight as part of our In Your Neighborhood series. A couple of major developments here. First, that $4 billion mixed-use development approved by City Council yesterday to go on the site of the old Michael Reese Hospital. We'll get the latest on that. Plus, the old Mercy Hospital, under threat of closing for so long, community members and public officials stepped in to find a buyer to save it for now. What are the future prospects of that very important safety net hospital? We'll get into that and more in just a bit, but first we toss it back to you.
Paris, thanks. We'll see you shortly. And now to some of today's top stories. U.S. Attorney General Merrick Garland landed in Chicago today. Here as part of his recent launch of strike forces aimed at reducing spiking gun violence across 5 major regions, including Chicago. These forces plan to disrupt illegal trafficking and prosecuting offenses that officials say put guns in the hands of criminals. Critics have expressed concern about flooding neighborhoods with even more law enforcement, but Mayor Lori Lightfoot touted the collaboration today.
Having the focus on a multi-jurisdictional basis to coordinate federal resources to address gun trafficking across state lines will make a huge difference here in the city of Chicago. Many of you know this. Our guns are not originating in Chicago. They're coming across the border from Indiana, from Michigan, from Wisconsin, and from some southern states.
And Chicago's top doctor, Allison Arbody, says the majority of people who are dying because of the coronavirus are unvaccinated.
Every COVID death in July to date in Chicago has been in someone who is not vaccinated, and it hasn't always been 100%, but it's been 95% plus in terms of protection against that.
Arbody says the city is reporting an average of 108 cases per day. Now that's up from an average of 58 per day a week ago. Now the lowest we've seen is an average of 34 per day. The Chicago Department of Public Health reports 108 is still pretty good. The goal, though, is to stay under 200, but the city is increasing rapidly. Students, teachers, and staff returning to Chicago public schools in the fall will be required to wear face masks regardless of vaccination status. The district sent a letter to families late this afternoon explaining the health and safety strategy for returning to in-person learning 5 days a week starting on August 30th. Additionally, students will maintain 3 feet of social distancing, and some students will take breakfast or lunch in their classrooms, while others will eat in the cafeteria. That is also to maintain staying 3 feet apart. Yesterday, City Council paved the way for a massive new development that could reshape the historic Bronzeville neighborhood on the city's south side. Bronzeville sits just south of McCormick Place and has been known for decades as the hub of black arts and culture in Chicago. As local public officials and residents cheer the potential for new housing and jobs, they're also optimistic about the future of a longtime community hospital that had recently been on the brink of closing. Paris Schutz and producer Nick Blumberg spent the day reporting in Bronzeville as part of our Chicago Tonight in Your Neighborhood series. Paris joins us again from 35th and King Drive. Hey, Paris.
Hey, Brandis, yeah, we're told that ground is going to break by late this year or early next year on that massive $4 billion development on the site of the old Michael Reese Hospital, tentatively called Bronzeville Lakefront right now, and it'll be built just south of McCormick Place, just west of that truck staging area, right off the coast of Lake Michigan. Viewers might remember that former Mayor Daley had proposed building an Olympic Village on that site when Chicago was in the running for the 2016 Summer Games, obviously as we get Tokyo 2021 underway. But thanks to unanimous approval by City Council yesterday, the path is now paved for a mixed-use development that supporters say will bring about 4,800 units of new housing, 20% affordable housing, senior homes, businesses, industrial facilities, and a health tech hub. Now, city taxpayers are going to pony up about $90 million to clean the site and to build out some roads and other infrastructure. This project is led by Farpoint Development, a Chicago-based company. They say it'll be built over the span of the next 10 to 15 years with the first tenants already signed up and ready to go.
Ultimately, this is going to be a mixed-use live, work, play community. It's going to be a healthy community of the future. And so right now, our focus is on amplifying the community of Bronzeville and affirming the culture here and building that into our site. So this first phase of work has only 4 or 5 buildings, but that'll take us a few years. But we're looking forward to groundbreaking on infrastructure and the new streetscape by the end of this year, early next year.
And speaking of former hospitals, community members are certainly glad that this facility, the old Mercy Hospital, is not a former hospital. Former owners, Trinity Health System, threatened to close because that safety net facility had been losing millions of dollars per month. But community activists and public officials worked around the clock to attract a new buyer. And there were some false starts here. Now, a Michigan-based company called Insight took it over with a pledge to keep it as a full-service inpatient and outpatient hospital for at least the next 10 years. And community activists celebrated the decision. They said a closure would have been devastating for Bronzeville residents.
So if you have diabetes and you live right over there in the Dearborn Homes, where do you go for health care? Where do you go for health care if you have to go to the emergency room and there's no full-service emergency room? So having a hospital helps to stabilize the lives of people who live in the community. A hospital that meets the healthcare needs of the community.
And we'll speak with the Chief Medical Officer of Insight Hospital to talk about plans for the future in just a bit in this program. Meanwhile, Bronzeville has lagged the rest of the city a bit in the COVID vaccination rate, coming in at about 43% of adults fully vaccinated in this zip code. One local facility, the Access Family Health Center, is treating and vaccinating residents. Doctors there say they believe unvaccinated members are starting to get the message now that Delta variant cases are on the rise.
Know that sitting in the vaccine site once a week. Last week our numbers were a little low. This week they're going up because I think people are realizing that as the COVID rates go back up, that they need to protect themselves.
And central to the life of Bronzeville, Brandis, as you mentioned, culture, specifically gospel, blues, and jazz music. The Harold Washington Cultural Center has been a community anchor for many years, but of course forced to shut down for the last 16 months because of the pandemic. Director Jimalita Tillman says they're not quite ready to welcome full audiences back for shows, so right now they're using the space for an all-day summer science, technology, engineering, arts, and math camp for Chicago Public School kids, run by Tillman's daughter, Dorothy Jean Tillman. What they say is the goal is not only to get kids turned on to those subjects, but to get them ready for school again in the fall, as most have been home for the better part of a year.
And many of the students, this is their first time returning to in-person socialization. So it's getting them acclimated to what they need to get ready for when they return to school. Following rules, protocol, becoming a young leader, and making good choices. And we're very proud of how we're rolling out programming here at the Harold Washington Cultural Center. They acted out a script that they wrote previously this week. And now we're here at dance, which is a part of the A in STEAM. And we have our interpretive more so dance that we'll be creating a performance out of. And later we have our hip-hop dance.
And the Tillman DNA runs deep here in Bronzeville. Dorothy Jean, the granddaughter of Jim Melita, the daughter of former alderwoman Dorothy Tillman. Connection there, and we're going to have more on Mercy Hospital and that new development and the local alderman Sophia King in just a bit. But first, Brandis, we toss it back to you.
Paris, thank you. The city is expanding a program that works to keep people addicted to drugs out of jail and place them into treatment. The Narcotics Arrest Diversion Program started in 2018 on the West Side and has since directed more than 700 people toward drug treatment programs. Officials say it'll be in every police district by the end of the year. Joining us to discuss the expansion are Tim Devitt, Associate Vice President of Clinical Operations at Thresholds, who's been working with the Chicago Police Department on the program, and Deputy Chief Antoinette Ursity of the Training and Support Group with the Chicago Police Department, which includes the Crisis Intervention Unit that is facilitating the expansion of the program. Thanks to both of you for joining us. So, Deputy Chief, let's start with you, please. Can you walk us through the process of how a person gets into treatment?
Sure. So there's two ways where someone can access this program. One is, just as you described the program, it is an arrest diversion initiative. And so if an officer takes an individual into custody who's in possession of 1 gram or less of cocaine or heroin or syringes, needles, drug paraphernalia, if that individual is open to seeing a substance use treatment counselor and meet the eligibility requirements of the program, we're able right there at the station to connect them with a substance use treatment counselor with Thresholds. One other really important way that people are able to access the program is by walking into the police station where this all started in the 11th district and letting one of the officers there at the desk know that they would be interested in this program, and they can reach out to our partners and access the program that way too.
And what are some of the eligibility requirements that you mentioned?
Sure, that you would need to be an adult. You'd be arrested within the geographic boundaries of the districts where this is operational. So right now we're really pleased we're in 14 districts. That's why we think it's so important that it's expanding at this accelerated pace due to the longstanding partnership here, that we've really got the foundation here to start growing it now. That the person is interested in the treatment. So there's several factors that would make an individual eligible.
Right, and one of those factors being no prior violent arrests in their background, correct, or violent charges?
Sure, that would be actually one of, I guess I'd say, one of the disqualifying factors. So if there's an individual who's arrested and there's another felony charge at the time that they're brought into custody or another arrestable misdemeanor offense, we're not able to connect them to the program at the point of arrest, but certainly so much has gone into training our officers on this resource, making it known, having opportunities like this to let people know this program exists, that the more people know about it, that it is accessible.
And Tim Devitt, once someone is in the care of Thresholds, what kind of treatment or services do they receive?
So what happens at the police station is we meet with the person and we understand, what's going on with them. We seek to understand. We look at their substance use. We'll talk with them about that. We'll talk with them about different treatment options. And then we work to link them to treatment in the community. There are people that will come to Thresholds for treatment, but we also work with other providers in the community as well. We're really basing it on what the person needs and where the best fit is for where they're at and their substance use issues and everything else that's going on as well.
Now, this program, we know that it started as a pilot in 2018. So looking at the city data starting the year after that, 2019, through today, there were over 8,000 narcotics arrests in the 11th district, but just over 700 people were diverted to use this program. Chief Ursity, why are not more of those arrests being diverted?
Sure. Like I mentioned, there are some factors concerning eligibility or entering into the program. So some of those those arrests that you're describing might have involved other charges. It might have involved an individual having convictions for serious crimes that would not make it possible to divert them at that point in the program. We also, because we've been working so closely with our partners, have been working to change our eligibility requirements. So for example, one of the important changes I think I'll share is that we've seen and understand really what the story of recovery can look like for individuals. So maybe for the data point where you're talking about, we see that one of the disqualifying factors is if you had used this program before and then were arrested again for that same offense, you would not be diverted at that point. But what we've really seen is that by expanding our eligibility giving more access to this program, that we see those kinds of changes are making it more accessible to individuals. So like a pilot program will do is you start somewhere and then you really try to enhance it. And so I think what we're talking about is trying to find the ways that we can enhance a program, such as changing an eligibility requirement like I just shared, and giving more access to individuals.
Right. And Tim Devitt, what's been the reaction from participants when they're getting into the program?
Yeah, you know, there's a number of people that will start right out and share with us that this is something that it's time, you know. That'll be a comment we hear often. You know, this is time. I'm sick and tired of being sick and tired, you know, will be what can be shared. You know, we work to understand what's going on and connect people. So we're offering, you know, connection to care. We're offering connection to substance use treatment. And for a lot of people we're meeting, this also includes help with housing, if they don't have housing, if they don't have a place to live, access to health care. We're offering naloxone education and distribution. Naloxone is the overdose reversal medication for opioid overdose, and so that's also something we're offering people. We're offering education and treatment right there. And people are in the before they leave the police station. So there's an array of things that we're offering with people, keeping in mind that engagement is a big piece of this.
So looking at last year's opioid overdose deaths, 49% of total deaths in Cook County were black people, many of them happening on the west side of the city where the program was first established. Tim, let's talk about that a little bit and that disparity. Why, you know, black people make up a third of the city's population, but black men in particular are being disproportionately affected by opioid addiction and death. What do you think the cause of that is?
You know, I think what's important for people that are doing this work and for organizations that are interested in being part of, you know, the solutions here is to get out into the community and actually see what's happening. And so much of the what we see anyway and what people share with us is that it's really challenging when an opioid addiction kind of develops for a person, and on top of that, they're in need of a place to live, they're in need of meaningful activities like work or income generating activities that come from a job. And so much of this early work with people is about helping to establish some of this as well. So we see, anyway, with the folks that we're serving, that this is a big need, and it's something that people are regularly asking us for help with. And so I can't emphasize that enough, that it's about addiction, but it's also about the social determinants of health, housing, employment, access to that, access to healthcare,
which
as
means
well.
Your work, yeah, for the two of you is certainly cut out, unfortunately. Tim Devitt at Thresholds and CPD Chief, or Deputy Chief Antoinette Ursity, thank you so much for joining us.
Thank you.
And now we check back in with Paris Schutz, who spent the day reporting in Chicago's Bronzeville neighborhood as part of our In Your Neighborhood series. Paris.
And Brandis, we're joined now by 4th Ward Alderman Sophia King. Alderman King, thank you so much for being here.
Paris, thank you for having me.
So we mentioned that big development that got approved by you and your colleagues yesterday, Bronzeville Lakefront.
Bronzeville Lakefront,
How impactful
Michael
would that
Reese
be?
development.
Yeah, former Michael Reese Hospital. How impactful will that be for Bronzeville?
It will be really impactful, but not just for Bronzeville, for the entire city. Obviously, since it's located in Bronzeville, it will immediately impact the residents here. But you're talking about a development that has so many amenities. You know, it's a mixed-use development, residential, retail, commercial space. Will bring about $4 billion in economic impact, taking the beleaguered land off of, putting it onto the tax rolls. Will also come with a lot of community benefits, paying homage to Bronzeville. So we're going to have a Bronzeville Welcoming Center / digital museum. It'll be 20% affordable housing on site. We're going to have resources for school, up to about $25 million worth of resources. It will have good paying jobs. Thanks to Unite Here, we're working on great hospitality jobs for the future here. So there's just so many things. construction work, professional services. This is going to be a real burgeoning community.
Well, as with developments like that, residents worry about gentrification or displacement.
Yeah.
Are those concerns that residents might have with this?
Yeah. So luckily, we were working with the local community. My office has been advised by a great advisory committee. We called it the Michael Reese Advisory Committee, but they're made up of residents who lived here. So we were really intentional about making sure that we mitigate issues of gentrification. So one of the things we did, again, was the 20% affordable housing. We wanted to make sure that people who live in the community, who were here during, let's just say, low times, could also ride the tide during high times so they can continue to stay in the community. So the 20% affordable housing on site was very intentional. And so things like that, we also made sure there was a write-down for small businesses and local businesses. They'll pay 20% less than larger businesses. So it was very, very intentional. I think this development is truly a development that's very transparent, and that I think the developers appreciate. That will be very beneficial for not only them, but also for the community as well.
And lots of community involvement. You didn't see the kind of protests that you see sometimes with some other developments that are happening on the south side, maybe further south than here.
Right.
Let me shift gears to the massive Police Oversight Commission that passed yesterday. And this has been negotiated for 4 years. Now, it does give the mayor veto power over what the commission wants to do with the superintendent or on policy. Is this the right balance here?
I really think it is a right balance. And speaking of, yesterday, very historical day, not only this great development moving forward, but also civilian oversight in a very meaningful way. Lots of people came together. As head of the Progressive Caucus, we had our caucus involved, we had the Black Caucus, we had the Latino Caucus, we had other aldermen involved. I think a really just collaborative effort to bring real reform to the police. And let's talk about what this is and what it isn't. This isn't defunding the police. It's really just bringing oversight to the police because we've had, Chicago has had, really kind of unprecedented bad, relationships with the police. And so this is something that empowers the community to have oversight. And that we did it in a collaborative way, I think, is really what is best about it.
Can this help public safety? I mean, a lot of constituents are wondering, well, this is good to have oversight, but how does it make our streets safer?
Well, it makes our streets safer by bringing the community into the process. I mean, it's the community that's complaining about, safety issues. But it also, I hate that people are trying to put, this oversight in a box and try and say that, it isn't going to make the community safer. It will make the community safer. People will have more trust in their police. When people have trust in the police, they talk to the police. That communication is very key in terms of safety. When police also understand who people are in their community, there's a communication beforehand, their presence is there. You mitigate further issues because they learn to respect their constituents and the community.
Certainly big ticket items passed out of City Council. Lots of collaboration yesterday with the mayor. All right, Alderman Sophia King, thank you so much for joining us out here today.
Thank you, for having me.
Good to see you. And Brandis will be back in just a bit with more on the former Mercy Hospital, now Inside Hospital. It's sticking around. It's not going to close, so we'll talk about that in just a bit. But now back to you.
Yeah, that's right. A lot going on in Bronzeville today, Pierce. Thank you. Up next, a local photographer is using her art to help women speak up. Stay with us. Is there anything that these police departments can do to earn trust from the community at this point? What inspired you to propose this bill?
Made some legislation. We've got to turn the page on this history.
What are the ways in which we can hold institutions accountable while also providing an opportunity for community to show up and not only just demand, but ask that we build these bridges together, because I think that that's the only way that we're truly going to get free.
There's a local photographer who hopes to make an impression on her audience and her subjects. For more than 3 years, Whitney Bradshaw has brought together women from the Chicago area for scream sessions, all in an effort to help inspire them to use their voices. We stopped by for a listen in 2018 when Bradshaw's work was on display at the DePaul Art Museum. Here's another look.
1, 2, 3. Nice. One of the biggest reasons I want women to scream is so that they can practice being brave and speaking up and out for themselves. 1, 2, 3. Ah! Yes! And so after you practice it a few times, it maybe comes more naturally in the real world. My name is Whitney Bradshaw, and I am a photographer. And now I've photographed about 200 women. I let everybody know when the exhibition's going on, when more photographs are being put up.
Whitney Bradshaw is a photographer based in Chicago, and she's installed more than 100 portraits of women screaming in the halls of DePauler Museum. She was inspired, starting during the Women's March in 2018, to create a space for women to express themselves. So she has these kind of screaming sessions in her home where she invites women to get together, and then she will warm them up and scream together, and then she photographs them individually.
When women come, usually I just have the door open and people just walk in, and then we all kind of introduce ourselves to each other. And then I talk about why I wanted to do this project. I worked with rape victims for 3 years in emergency rooms in Chicago. So when I was 21 till I was about 24, anytime a woman, a man, or a child was raped, I would go to the hospital and I would be their sole supporter. I always wanted to do a project about this, but I wanted to do one that was empowering and fun for the women involved, and something that wasn't just really dark and hard and difficult, but also that there was this lightness to it. I choose screaming because it's a thing that can save us. 1, 2, 3. And then everybody takes turns coming in front of the camera on their own.
From the time I was a little girl, I heard that I was too loud. I find myself backing up and backing up and backing up all the time just to accommodate people's sensibilities. So I was like, I can go scream. So it was kind of a chance to just kind of let it be.
In the beginning, like when I first got here, I wasn't really like feeling like any emotion towards it.
Gay is okay!
I love it.
While I was screaming, like I wasn't even really sure what I was screaming about until like, I don't know, like well into the scream, and then I started like feeling all these emotions, and when I was done, I was like, wow, I didn't even know like that was something that I was feeling until like this exact moment.
To scream was a release. A lot of times, as I'm a mom, I'm also a teacher with CPS, and there's a lot put on us, a lot of pressure. Because, you know, as a teacher, we have many hats we have to wear, and to have this one day, this moment right here, that I scream for my students. I scream for all the children of CPS. I scream for kids around the world. So that's why.
This idea that we have to be pretty and smiling, you know, and all the pressure that's put on us for how we look makes a project like this hard, you know. So it's not just the bravery of being able to say something, but it's also the bravery of being able to be captured in a way that isn't idealized beauty.
Throughout the history of art, women have been represented primarily in service of the male gaze. So what happens when you sort of change that and women are depicted for other women?
I hope that women leave here feeling more powerful than they felt on their way here. I hope that women leave here feeling more confident, being able to speak up and out for themselves. I really hope that we all feel a stronger sense of community. I have this fantasy that someone's going to call the police at some point, and the police are going to come, and it's going to be 2 females, and they're going to want to scream with us. This is my fantasy. So far it hasn't happened, but if it ever does, I will be very happy about it. 1, 2, 3. Awesome.
Good.
It was incredible.
Yay!
Since January 2018, Whitney Bradshaw has photographed more than 375 women, quote, letting it all out. And now, for the first time, all of the portraits are on display in a new exhibit. It's called Outcry, and it's at the Thomas McCormick Gallery until September 4th. Oh, and the Scream Sessions? Bradshaw is still hosting them. Anyone who identifies as a woman can sign up. The next session is this Saturday at the gallery. You can find details on our website. Still to come on Chicago Tonight, podiums made out of recycled plastic and much more, how sustainability is getting a gold medal at the 2020 Olympics. Researchers create technology that can translate a paralyzed man's brainwaves into text. We review some science stories in the headlines. We've got more from historic Bronzeville, including a conversation with the new owners of the once embattled Safety Net Hospital. Our Jeffrey Bayer has the story of two famous Germans who have set up permanent residence here in Chicago. But first, some more of today's top stories. U.S. Attorney General Merrick Garland is in town to double down on the federal government's push to help local law enforcement crack down on gun trafficking. Chicago Police Superintendent David Brown touted the support which would partner CPD with federal agents.
We are not limited to just the borders of the city of Chicago. We can go find these guns, trace these guns back to their original sale so that we can hold these people accountable for violating both federal law and state law and prosecute them to the highest extent that the law allows.
Birth control will soon be available over the counter in Illinois. Governor J.B. Pritzker signed a bill today allowing pharmacists to provide 12 months of contraceptives without a prescription beginning January 2022. This means birth control pills, rings, and patches without a doctor's prescription. This makes Illinois the second state in the Midwest to provide birth control over the counter, right behind Minnesota. And if you heard last night's segment with music critic Jim DeRogatis and University of Chicago Dr. Emily Landon about whether Lollapalooza should still turn up despite the increase in COVID cases, here's what the governor plans on doing.
I intend to go to Lollapalooza. I'm bringing my wife and a few friends to Lollapalooza, so I think it's okay. But again, people need to be aware that we are not past this pandemic. It is with us.
You heard it right. Governor Pritzker says he plans to attend the 4-day music festival in Grant Park next week, but he advises anyone who's attending to keep distance between themselves and other music lovers and acknowledges it is, of course, safer if you are already vaccinated. The festival will be at full capacity, which in the past has been more than 100,000 people per day. This year's entry protocols require attendees to be fully vaccinated or show a negative COVID test within 72 hours of arrival. And if you missed last night's segment on this topic, you must visit our website. Barack and the Boss are writing a new book. It's a bound version of their podcast called Renegades, Born in the USA, where the pair of renegades, seen here in this announcement video, they discuss everything from fame to cars to the state of the country itself. Publisher Penguin Random House and the Obama's Higher Ground production company say the book will include rare photographs, handwritten Bruce Springsteen lyrics, and Obama speeches. It'll cost $50 and be released in late October. The 2020 Olympics are finally set to begin tomorrow in Tokyo after a year-long delay. But the event's name and logo aren't the only things recycled from last year. WTTW News reporter Patty Wetley joins us now to explain. So, Patty, the Tokyo Games are putting sustainability measures front and center, starting with the beds in the Olympic Village.
Yeah, there's been a lot of sort of wink coverage about the bed frames, which are made of recycled cardboard. And athletes have taken to Twitter and shown that they're plenty sturdy enough for whatever they get up to. But it's all part of a broader sustainability plan that the Olympic organizers have to use as many recycled materials as they can, and also to use as many things that can be repurposed after the games.
I'm impressed that the Japanese have been able to build a cardboard bed that is sturdy. I've seen athletes jumping on them, and they're fine.
I know.
So the medals and the podium are also made from recycled materials. Tell us about that.
Yeah, this is another really cool thing that they've done. The medals are made from gold, silver, and bronze that have all been salvaged or reclaimed from smartphones, recycled smartphones, and other electronic gadgets like laptops and digital cameras. And the podiums are 3D printed from recycled plastic from, household items like shampoo bottles and laundry detergent containers. And all of these, the Japanese people donated, 6 million of their smartphones, like 13 tons of household plastics, all contributed, donated to this Olympic effort.
A countrywide effort. How did the country pull off this sustainability effort? What else did they do?
They had collection bins set up at thousands of retailers all across the country. Schools got in on the action, organizations and businesses. This started in 2019. So, before the pandemic hit, they were obviously already gearing up for these Olympics. Big, massive nationwide effort to pull this off.
Okay, so Patty, Olympics are starting tomorrow with the opening ceremonies, that is. What is your favorite competition?
Oh my gosh. You know what? I didn't used to like it, but the synchronized swimming is really kind of bizarrely interesting.
It is really impressive. Some people might argue that's not a legit sport, but tell that to the athletes who are in the water coordinating that underwater for that long. Yes, all right. Well, thank you so much, Patty Whiteley, for joining us, as always.
Thanks, Brandis.
And you can read Patty's full story on our website. It's all at WTTW.com/news. Turning a paralyzed man's brainwaves into text, a 3D printed hand that plays Nintendo, the pandemic upends preventive care for many women, and why snakes turn out to be very good radiation monitors. We'll explain that. Joining us now to talk about some of the latest science stories in the news is Rabia Mayes, Vice President of Education at the Museum of Science and Industry. Rabia, welcome back. Thanks, of course, let's start with this. Paralyzed man's brain waves have been turned into sentences on a computer. Researchers at the University of California have been able to translate these sentences onto a screen. This sounds pretty remarkable. How'd they do that?
Absolutely. It's a fascinating story about, as you say, a man who'd been paralyzed for years and had been communicating with devices that many people with those limitations use. But this research involved implanting a device in his brain that allowed the device to control the part of his brain that controlled his vocal cords, which were paralyzed in this particular man. And over time, over months and months and months of time, the computer system was able to learn and connect with some of what the man was wanting to say, what his brain waves were trying to do and control his vocal cords, and ultimately turn out into words.
How'd the computer know which words he was intending to say? How do we know the computer was right?
Yeah, so in fact, it turns out that the computer wasn't always right. So we know that it's not 100%. It actually is, it makes a lot of errors, but the computer is really set up to learn over time. So the researchers worked for a long time with the man to help train the system to understand and make the right connection between what was happening in the brain and the word that he intended to use. So it was a long process. It's not perfect, but what's really amazing about this is that it's working, and the man is able to communicate through this system.
Okay, so let's talk about this 3D printed robotic hand. University of Maryland researchers have 3D printed a robotic hand that can play Nintendo, which sounds cool. I'm not sure how useful it is. Tell us why they did this.
So I think we all know, we've talked about it before, 3D printing is kind of amazing, and there are so many things in the last few years that 3D printing technology has allowed researchers to do. But one of the things that's always been really challenging are 3D printed objects that are soft or had fluids in them. They are just so much more difficult than some of the kind of hard plastic 3D printing that we do here at the museum and at other places. And so this particular technology allowed them to use an integrated fluid model of 3D printing that allowed them to control the robotic hand with pressure and can play Nintendo with it, which is super cool, especially for those of us who love Nintendo.
I was going to say, especially if you're a gamer, it's probably pretty cool. So right. I understand this type of robotics, it's not powered by electricity. What powers it?
Yeah, so there's a circuit that basically is responding to pressure. So if the system applies a low pressure to the hand, it would press a little bit of the first finger, for example, and the researchers say it made the Mario in Super Mario Brothers walk. If you added more pressure, Mario would jump instead of walking. So if you think about your own hand, that change in pressure allowed the 3D printed hand to essentially behave like a regular hand and actually complete the first stage of Super Mario Brothers.
Not only playing the classic Nintendo, but also Super Mario Brothers. So
that's right, and probably faster than me.
Probably, you and me both. So researchers at the University of Michigan, I get paid to talk, they've been looking at the impact of the pandemic on women's preventative health care. What did they find?
So this is something that we all should be paying attention to, and I think we can all understand that during the pandemic, this research found that adult women, when compared to 2019, were 20 to 30% less likely to receive standard health services. So birth control, cancer screenings, sexually transmitted infection screenings, and found that that drop was really the biggest in the early part of the pandemic when many states were only permitting critical and urgent healthcare services.
And this study also suggests that there were some racial disparities in access to preventative health care, of course, again, worsened by the pandemic. How were researchers able to make that connection?
Yeah, so the data for the study didn't include really detailed demographic information. So they actually used information from the US Census to look at zip codes and information about race and income, and found that in the zip codes where there are people who earn lower incomes and are of racial minority backgrounds, those were some of the populations that were more deeply impacted by the pandemic. So it's another reminder that the pandemic really exacerbated some of those disparities, and really hoping that people are getting back to their healthcare now that things are opening back up.
Okay, so using snakes to monitor the Fukushima radiation, this is a good one. So researchers from the University of Georgia are using snakes to measure radioactive contamination. How does that work, and why snakes?
Okay, so I have the same question because I was a little creeped out by it. But one of the cool things about this work was that we think about snakes and how they live and how they move. They are on the ground, they are in the ground. So they're touching and connecting with the soil all the time, right? And this particular kind of snake, it's a rat snake. It lives in Japan. And one of the things about this kind of snake is it doesn't typically go very far. So you can track it without losing it. So the team attached GPS trackers. I was really excited to hear that they used tape and super glue onto the back of snakes and tracked them for more than a month, and were able to find that the levels of radiation that were in the snakes correlated with what was found in the soil.
Okay, and we've got about a minute left, but if you wanted to measure contamination, why use an animal as opposed to a scientific instrument, like the Geiger counters, to just, measure it in the soil contamination?
Yeah, so I think this is a way of kind of attaching a scientific instrument to a snake, right? So it's a little bit of a combination. And so when we think about what it would take for a human to enter a particular area and to use something like a Geiger counter, snakes have access to lots of different areas. They can get underground, they can get into small areas, and perhaps even places that are not safe for humans to go. And so this research was really interesting, using animals that live in the area already. They know the area, and we can find out information about the radiation and contamination in ways that a physical human probably wouldn't be able to do.
Yeah, another way that the snake is useful besides catching mice. All right.
Right.
Rabia Mayes, good to see you as always. Thanks for joining us.
Thanks, Brandon.
Up next, more from Bronzeville as part of our In Your Neighborhood series. Stay with us.
Coverage of science and technology on Chicago Tonight is made possible in part by Joel M. Friedman, president of the Alvin H. Baum Family Fund.
And now back to Paris Schutz, who's co-anchoring tonight's show from Chicago's Bronzeville neighborhood on the South Side as part of our In Your Neighborhood series. Paris.
Yeah, Brandon, earlier today I spoke with Dr. Asim Saeed, who is the Chief Medical Officer of Insight Hospital, formerly Mercy Hospital here in Bronzeville. I began by asking him whether Insight was committed to its contractual pledge to keep Mercy a full-service inpatient and outpatient hospital until at least 2029.
Absolutely, and we pledge to continue to do it past 2029. That's our goal.
And, there have been community groups for so long that have fought to keep this hospital open. The former owner said they just couldn't make it work. They were losing millions of dollars a month. How do you financially make this work and keep it a full-service hospital?
Sure, absolutely. That's a really good question. I mean, if you think about it, really it's just about being strategic and being efficient. There's been a lot of support from the state, from the community, from the city. And so again, it's just about really just good management and being efficient and strategic in how we operate.
What are the things that you had to change to make it solvent?
Well, I think we're still in that process right now. As you know, that we kind of had limited access to the hospital, getting into the hospital. And so right now we're kind of using this time wisely to kind of go through everything, really kind of just the infrastructure and things like that to, really narrow down in on what can be improved and what we can make efficient to move forward with.
And tell me where you're at right now in terms of how many beds and what kind of services you're offering, and then where you hope to get.
Yeah, no, our goal is to get back to full capacity as soon as possible. That is a commitment that we've also made to the city and to the state and to the community. Right now, currently, our OR is back open. Our ICU is going to be opening next week. Our behavioral health unit is open to full capacity right now. Our general medicine beds are at lower capacity right now, but we anticipate for that to open back up once we get the ambulances back on.
And to the residents of the community that were very worried about this hospital closing, tell us, what services can they get here at this hospital right now?
Well, for right now, I mean, we do have the basic ER open right now. They're more than welcome to. We welcome them to come back to us if they need help or need care, or if they need attention or need just any sort of guidance. For the most part, right now, if a typical patient that comes in that has chest pain, we do have cardiology services here. A patient that would come in would need to get a chest pain rule out to make sure that their heart is okay. So we do have the basic services available. As we plan to add on more, then you'll start having more, comprehensive and advanced levels of care coming in.
And I think you know very well the concerns of community groups over the years. Why does Insight believe that this hospital is necessary for this community? I mean, you talk about you have University of Chicago a couple of miles away, other hospitals a few miles away. Why is this hospital essential here in Bronzeville?
Sure, absolutely. I mean, if you look at Bronzeville geographically, the way it's been divided up by the highways, it's almost like an island that's out here right next to downtown. So access to care is still very difficult. This hospital has been a community center that really has just been access of care for patients. So really, from an access point of view for this community, it's absolutely very, very important. Down right to the services like giving birth for children, for women's health, things like that. A lot of times having that access that's readily available to you is very important.
And Insight is still committed to charity care or a certain level of charity. It can do that and still remain solvent?
Absolutely, yeah.
Let me ask you about COVID as well. What are you forecasting in terms of COVID rates in this community and at the city at large, given that we've seen them go up?
Yeah, I mean, right now we're seeing that in the state of Illinois, the cases are starting to go up slowly. We are seeing that, states like California have reinstituted the mask policy. So initially we had planned that, usually by the fall time, as the flu season goes back up, that we're going to be prepared for that. But we are thinking that, in the next coming weeks, we probably may see something happen. Again, I don't want to speak.
In terms of a surge?
I wouldn't say surge, but I'd probably say, cases going up. Probably maybe reinstitution of the mask policy, but that's up to the Department of Public Health. I don't want to really go into too much into that, but we are being very mindful and watchful of that.
So we should mention residents here are optimistic about Insight Hospital, although cautiously optimistic, because as you heard, they are not at full capacity. Only a few services, the OR and the ER, and some other services running now, as they said, slowly ramping up to get back to full capacity. As they said, their goal was, so residents will be watching that. And Brandis will wrap things up here in Bronzeville in just a bit, but now we toss it back to you.
All right, Paris, we'll see you in a little bit. Thanks. Up next, an encore presentation of Ask Jeffrey. But first, we'll look at the weather.
Chicago Tonight is made possible in part through the generous support of the Julius Frankel Foundation.
Two famous Germans take up permanent residence in Chicago, only to witness the evolution of a West Side neighborhood. Jeffrey Bayer is here with the story of two enduring Humboldt Park statues on this week's Ask Jeffrey. Hello again, Jeffrey. So this question, hi. This question comes from Stephen Livesey of Palos Heights. The question is, Do you know if a statue of German writer Fritz Reuter is still standing in Chicago? I read that a statue of him was erected in Humboldt Park sometime in the 19th century. Reuter was at that time famous as a writer of Low German prose and poetry.
Well, the Fritz Reuter statue is still indeed standing in Chicago's Humboldt Park. Now, you may or may not have ever heard of Fritz Reuter, but he was a household name in Chicago's large German-American community during the late 1800s, and his popularity is reflected in the bronze statue's larger-than-life size. It's 9 feet tall, and its prominent location overlooking Humboldt Drive, which is just north of Division Street in this West Side Park. Reuter was famous for his poems and novels of traditional German village life, often written in Low German or Plattdeutsch, and that's a dialect originating in northern Germany. It's still spoken today. Some of his famous titles include, okay, I'm going to do my best Low German attempt here. Ut Mina Stromtid, which was published in English as From My Farming Days, and Ut Mina Festungstid, which means during the time of my incarceration. He was jailed for high treason for political activity in his student days, but his sentence was later commuted. The Chicago Tribune called him the people's poet of Germany, and many people have compared his writing and his fan base to Charles Dickens in English. Reuter died in 1874, but his fame stretched on for decades. In the early 1890s, a group of Chicagoans created the Fritz Reuter Monument Association to raise money for a memorial statue. They hired sculptor Franz Engelsmann, whose statue of Reuter was unveiled in 1893, when reports say more than 50,000 people attended the dedication ceremony there in Humboldt Park.
And Jeffrey, Reuter isn't the only German memorialized in that area.
That is absolutely right. We can't forget the park's namesake himself, Alexander von Humboldt, who has his own statue just north of Reuter's near Humboldt Park Boathouse. Humboldt was a famous German naturalist and explorer, and he's been called the forgotten father of environmentalism. His extensive career took him all over the world, including to South America, where he meticulously recorded plant geography and mapped the harmful effects of colonial plantations on the environment. And scientists today are still using Humboldt's findings, like this stunning illustration that he did of the layers of vegetation on a volcano in Ecuador. Just a few years ago, a scientific study cross-referenced Humboldt's accounts to track how plants on that same volcano have migrated upward over time to cooler ground as we've had global warming. Like Reuter, Humboldt was another national icon for German immigrants in the United States. His statue was unveiled a year before Reuter's in 1892.
Now, of course, as we've shown in our video, Humboldt and Reuter, they're both still standing, but the neighborhood around the park has changed quite a bit.
Oh, it definitely has. Like so many Chicago neighborhoods, Humboldt Park has been home to a plethora of different cultures and populations over the last century. Germans and Scandinavians settled there in the mid-19th century. They were followed by Poles, Italians, and then Russian and German Jews. By the 1960s, Humboldt Park had become the epicenter of Chicago's Puerto Rican community, which it is today as well. The Paseo Boricua on Division Street is marked by these massive steel Puerto Rican flags found near Western and California avenues. In between are Puerto Rican restaurants, barbershops, and many more small businesses and community organizations. But you can still see the German influence in some of the park's architecture. These are the stables, currently the home to the National Museum of Puerto Rican Arts and Culture.
All right, Jeffrey Bear, thanks so much as always.
My pleasure.
And we're back with more right after this. And we're joined again by Paris Schutz, who spent the day in Bronzeville as part of our In Your Neighborhood series. Now, Paris, you talked with 4th Ward Alderwoman Sophia King about the landmark civilian police oversight ordinance, which just passed yesterday. What did you learn about how that came together?
Well, I mean, there had been debates on this for years, Brandis, and it really had been languishing for a while. Community groups are angry that it hadn't been moving. And so, you know, what I learned was over the weekend, a group of alder people got together Saturday, Sunday, round the clock, and the mayor's team came in, and they kind of negotiated this final sort of version of it that passed. It's a pretty incredible achievement given the acrimony that had been in City Council. This got 36 votes, an example of different coalitions in the council working together with the mayor on a big piece of legislation. So there are some aldermen that believe perhaps this starts momentum for more collaboration. Maybe the trust is being built a little more. But no small achievement, regardless of whether people like the ordinance or don't like the ordinance. It was people coming together to pass something.
I think that's the way a lot of folks probably like to see government work, is people coming together in a coalition forming, even if they disagree, because we see a lot of disagreement across the city sometimes. Paris, thank you.
Sure.
And that is our show for this Thursday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
You can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7 for the Week in Review. And now for all of us here at Chicago Tonight, I'm Paris Schutz.
And I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that supports free educational initiatives in the legal profession.
This evening's presentation of Chicago Tonight is made possible